Hello, I'm Dr. Sinchana. I am a senior specialist at Aster Hospital in Paediatrics and PICU department. Today I'm going to talk about common cold in children. Since the beginning of the last school year, we have been hearing complaints from parents about how the kid is falling sick every other month. They are worried. Their most frequent question was, is my child really sick? Do they need any immunity boosters? Now, this common cold, it's an umbrella term for many viruses. It includes RSV, rhinovirus, influenza, parainfluenza, corona, to name a few. Are these viruses are always in circulation? No, normally we see these viruses only during the winter months. But during the last June, it made an unusual appearance. As soon as the COVID restrictions were lifted, we saw a surge in the RSV viruses in kids. And this was followed by metapneumovirus, flu viruses, adenovirus, rhinoviruses, to name a few. We looked at our own data to analyze this viral profile, and what we saw was each month, each virus made many peaks and ebbed, and this caused multiple infections in your little kids. Now, who are the most vulnerable kids? So, before talking about it, let's understand what is immune memory. When we are exposed to a virus, our body makes a memory of it and reminds us when the need comes. Due to COVID restriction, our under 5 kids who lived in a cocoon and had nil memories were exposed to one virus after the other. As each virus is different, they had to suffer through it every other month and were falling sick. Do these common cold viruses affect everyone the same way? Sadly, no. Though many kids were treated on OPD basis, some were very sick and required hospitalization and ICU care for oxygen support and ventilator support. Especially RSV virus, which is the most commonest cold virus, can be very notorious in younger kids, and that's what we saw in our study. When RSV made a surge, most of the kids were hospitalized, required oxygen support called HFNC and ventilator support. Does vaccines help? The vaccines which are available are mainly flu shots, and it covers only influenza viruses. These are usually available during May onwards when a new batch comes, and it's available at a hospital too. But many other viruses like RSV, rhino are not covered under these vaccines. So the kids are still vulnerable to these viruses, even though they are vaccinated with flu shots. So you may ask, do they need social distancing, mandatory wearing of mask? Well, it is very difficult to impose everyone to wear mask at this stage, but it's always good to take care of ourselves by wearing mask, repeated hand washings, coughing into our elbows, avoiding crowded rooms. And one may ask whether we have to stop sending our kids to the school. Since we are heading into the summer holidays, we may need not worry about it for the next 2 months. Kids are already away from school and you will probably be traveling. It's always better to take extra precautions while traveling, like avoiding crowded rooms, avoiding crowded compartments, travel areas, and mandatory mask wearing, at least with kids who are sick and elderly people also who frequently come in contact with these kids. If they are suffering, how to go about it? If fever is there for 1 to 3 days, there is nothing much to worry. Mainly what we have to do is good hydration and to take care of the fever using paracetamol medicine. But if they have other symptoms like vomiting, pain abdomen, unable to eat and drink, then they require extra support and extra visit to the nearest hospital. Here at Aster RV Hospital, we do come across these cases every other day. We have a multidisciplinary team who are available 24/7 at emergency OPD services to address the needs of these children. And we do have an ICU facility if an extra support is needed for the vulnerable kids. Thank you.